Now let's have a look at the oral cavity. First of all, I think it's important to understand that the oral and the nasal cavities are able to communicate with each other via the pharynx, which is just posterior to it. If we think about the boundaries of the oral cavity, the roof of the oral cavity would be formed by the hard palate anteriorly and the soft palate posteriorly. Anteriorly, you have the lips and the muscles that are associated with it. Some of these you will have already seen if you have watched the facial muscles video before. Do you remember this muscle that goes all the way around the oral opening? It's called the orbicularis oris. The fissure between the two lips, when you part your lips, you open your mouth, well, that is just called the oral fissure. That is the gap between your lips that allows, of course, for the passage of food and drink. The oral vestibule describes the space which is between your dental arches and the mucosal lining of the cheeks and the lips. So it's basically this little gap that you sometimes might get food caught in between your gingiva and your upper or lower teeth, or in your cheeks. The lateral wall, here's the cheek. Well, this is an important muscle that is already highlighted here. That is the buccinator or buccinator. One important little factoid, which again you might already know if you've watched the video on the face. You see the buccinator is pierced by the parotid duct here. The parotid gland sits on the outside and the buccinator sits right here on the side. And in addition to forming the lateral boundary of the oral cavity, well, it also helps keep food between the occlusal surfaces of our teeth by contracting. The proper oral cavity is going to be the space that is between the dental arches, and it is usually pretty much filled up by the tongue. The idea that the oral cavity is a space that is hollow with nothing in it when our mouth is closed is actually not correct. There is very little space in it when our mouth is closed, unless of course we have some fluid or some solid foods in our oral cavity. And the inferior boundary of the oral cavity is composed of the suprahyoid muscles and the tongue. So the rapid summary would be the oral cavity proper is bounded by the teeth, the alveolar processes, and the gingiva anterolaterally. The roof is going to be made up of the palate. Posteriorly, the oral cavity will communicate with the oropharynx via a region called the oropharyngeal isthmus, which is an opening which is bounded on the left and right sides by something called the palatoglossal arches, which are arches of soft tissue between the palate and the tongue. So before we move on to the nerves, arteries, veins, and muscles that are concerning the oral region, let's have a look at a couple more things that might be a little bit more superficial. First of all, we have something that is called the oral vestibule. And the oral vestibule is quite simple. It is this slit-like space here that is right between the lips and the cheeks superficially, and the teeth and the gingiva deeply. The lips, quite obvious and just about everybody you know, are these mobile, fleshy, and quite muscular folds that surround your oral opening. They contain a couple of muscles, for instance the orbicularis oris, that as the name implies, orbits or surrounds your mouth, and also the superior and inferior labial muscles to move the upper and lower lips, and the associated nerves and vessels. On the outside or exteriorly, these are going to be covered with skin, and on the inside, you can check on yourself, you just pull down your lower lip for instance, they are going to be covered by mucous membrane. This vertical groove up here is actually called the philtrum. As the skin of the lip approaches the mouth, changes color quite abruptly to red. And this red margin is actually called the vermilion border, which is a transitional zone between the skin and mucous membrane. The skin of this so-called transitional zone is hairless. Now you will see that people have hair on their upper lips, which is not the actual, hairless lip part, but never on the lips themselves. And the reason that the lips are actually so bright red, or sometimes darker brown, is because of the underlying capillary bed. If you've ever bitten your lip or cut your lip in any other way, you will know how much they bleed. And the upper lip is going to be supplied by the superior labial arteries of the facial and infraorbital arteries, whereas here the lower lip is going to be supplied by the inferior labial arteries, which come from the facial and the mental arteries. The nerve supply is going to be superior labial branches of V2, so the maxillary division of the trigeminal nerve, and the nerve supply of the lower lip, as you can see here, is going to be derived from branches of V3, the mandibular division of the trigeminal nerve, specifically by inferior labial and mental branches. Switching over to this view, lymph from the upper lip is drained together with lymph from the lateral parts of the lower lip, primarily to the submandibular lymph nodes, like this one right here. Whereas lymph from the medial part of your lower lip, as you can see this region here, initially is going to pass to the submental lymph nodes that, as the name implies, are going to be just here in the mental region. The teeth are up next. The teeth are more or less conical structures that are sent in the tooth sockets, which are the dental alveoli. And they are not just for mastication, so for eating, grinding down food, but they also help us in articulation, so in speech. Kids have 20 deciduous teeth, those are the primary teeth, and adults have 32 secondary teeth. If we look at the teeth, we can see that there are going to be 16 permanent teeth in each jaw. 1, 2, 3, 4, 5, 6, 7, 8, and the same on the other side. There are going to be 3 molars, 2 premolars, 1 canine, 2 incisors on each side. And this set of teeth is usually complete by the mid-teens, except for teeth called the third molars, which are also referred to as the wisdom teeth. They usually don't erupt until your late teens or maybe even early 20s. And some people, they don't erupt at all. They can become impacted, which can be problematic and might require them to be extracted surgically. If we look at the tooth itself, we can see that each tooth has different regions. The crown here is the part that projects from the gingiva. The neck is the part of the tooth between the crown and the root. And the root itself is the part that is fixed in the alveolus by a structure that is called the periodontium, or periodontal membrane. Most of this tooth is comprised of a substance called dentine, in Latin dentinium, which is then covered with enamel over the crown and cement over the root. So now in this more detailed model, we can see on the outside of the tooth is the enamel. Here is the gingival epithelium. Deep to the enamel is going to be your dentine, and deep to the dentine is going to be the dental pulp, or the pulp cavity. The pulp cavity will contain all of the connective tissue and the blood vessels and nerves that supply the teeth. They will supply this through the apical foramen of the tooth itself, which is this opening down here and down here. The arteries that are going to be supplying the teeth are going to be the superior and inferior alveolar arteries, depending on if you're looking at a maxillary or mandibular tooth. And the nerve branches or innervation of the teeth, again, will correspond to the maxillary or mandibular division, depending on if you are looking at teeth in the maxilla or the mandible. Next, the palate will form this roof, the arched roof, over the proper oral cavity, and that also makes up, of course, the floor of the nasal cavity. The palate has both a hard palate, which is bony, and a soft palate, which is muscular and fibrous. The hard palate will separate the anterior part of the oral cavity from the nasal cavities, and the soft palate, together with the Palatine Aponeurosis, is going to separate the posterior part of the oral cavity from the nasopharynx above it. The hard palate is going to be covered by this mucous membrane here, and the features contributing to the formation of the hard palate are going to be palatine process of the maxilla and the horizontal plates of the palatine bones. There are 3 openings of the hard palate. Let's have a look if we can find those openings. I've removed everything that would be in the way otherwise. We are zooming in and looking underneath here. And we can see there are indeed going to be 3 openings. There is one here, which is the incisive foramen for the nasopalatine nerve. Then a little bit further posteriorly, we have the greater and lesser palatine foramina for the greater and lesser palatine nerves and arteries and veins. So to look at a couple of the features of the soft palate, we're going to have to switch into a posterior view. That's going to take a little bit of getting used to. Please note I've removed the teeth here that we can actually look through, because when I scroll in, we have a look through the oral cavity. Here's the tongue. And then you have here several muscles that are arching down, right? Here's the palatoglossus, there's the palatopharyngeus, and this back here is one of the pharyngeal constrictors. And that muscle is going to be the salpingopharyngeus. That is a muscle that actually goes to the eustachian tube. I'm going to switch around into the posterior view. Now you see the muscles that contribute to the soft palate. That will be the levator veli palatini, tensor veli palatini, the musculus uvulae or uvular muscle, the palatopharyngeus, and palatoglossus. All of these muscles, but one, markedly the tensor veli palatini, that one's innervated by V3. All of these are actually innervated by branches of the vagus nerve via the so-called pharyngeal plexus of nerves. Of special note is the tensor veli palatini, at least in my opinion and in my book, so to say, because it has an interesting course. So if I look at the tensor veli palatini, not only is it interesting because it's innervated via V3, where all the others are innervated via the pharyngeal plexus of nerves via the vagus nerve, this one actually is pretty cool, if I may say so myself, because it has a triangular belly. Maybe I can isolate it for us. Let's zoom in. It actually has a triangular belly that passes inferiorly, and the tendon formed at its apex hooks around the pterygoid hamulus, which is a little bony protection of the medial pterygoid plate, before it then spreads out down here as the Palatine Aponeurosis. And that's pretty cool. It's actually quite shiny when you dissect this out in lab.